Welcome to podiatryorlando.com. Where certain indications exist, hyperbaric oxygen may be of great benefit. Hyperbaric oxygen involves placing your entire body in a large tank with increased atmospheric pressure and increased oxygenation. In theory, increasing the atmospheric pressure around your body and outside of your body with increased oxygen concentration drives the oxygen into the blood, increasing concentrations of oxygen and hence potentially increasing oxygenation delivery to the tissue systems within your body. This may be beneficial in cases of peripheral vascular disease or non-healing wounds. In the realm of wound care, which we do a lot of, patients may be faced with the option of considering hyperbaric oxygen. Patients who are claustrophobic may have a problem with this. Patients who have ear problems may need tubes placed into their ears. Patients with other medical problems may not be candidates. However, hyperbaric oxygen is known to be of benefit to a certain percentage of the population. Patients who are diabetics, who have chronic wounds or perhaps osteomylitis, who may not be surgical candidates or who wish to avoid surgical resection of bone, may wish to enhance their treatment of bone infection and use hyperbaric oxygen as an adjunct therapy. Diabetics with bone infection usually undergo a course of antibiotics, either intravenous or by mouth, for a 6 to 8 week period of time. Coupled with hyperbaric oxygen and aggressive local wound care involving debridement and specific dressing change options, this may enhance the potential for wound healing. There are many parameters that need to be addressed in patients who have problems with slowly healing or non-healing wounds. Arterial circulation needs to be addressed and enhanced if possible. Appropriate antibiotics may need to be delivered to the wound area. Necrotic tissue may need to be debrided or removed from the wound area. The patient's nutritional status may need to be enhanced, and certainly one of the most important things is appropriate blood sugar management. A diabetic patient who has elevated blood sugar levels, who has maintained elevated blood sugar levels, reduces their chances of healing the wounds or healing them to completion. Hyperbaric oxygen may be an option, and hyperbaric tanks can be seen in multi-chamber facilities or perhaps on a monochamber. In a monochamber, the patient will be placed on a gurney and slid into a chamber, usually encased in plexiglass. The patient may stay in the tank for as much as 90 minutes with increased atmospheric pressure and increased oxygen. After the 90 minutes of therapy, the patient is returned to atmospheric pressure and slowly removed from the tank. Hyperbaric oxygen therapy may be rendered daily for as much as 20 to 30 dives.